understand. All my academic friends are a little bit cautious with this, and I think rightfully so, especially with this subject, right? Because
in particular,
there's just so much lore out there, and that's what I really love. What you're doing and the protocol you invented is it's so clever, and I think it's something that's needed right now. So but I cut you off. I think you were just about to go into the self-blinding protocol.
But like, so that study is done. So we are actually under peer review. So we have collected all of the data, and actually the peer review, like we submitted it a while ago, so we should get back it fairly soon, I think. I think realistically it's going to be out before the end of the year or around the end of the year.
Oh, great.
But anyway, the point is that it's coming relatively soon, given that like it started 3 years ago or something like that. We are near the finish. But microdosing and psychedelics are obviously cool and interesting, but what we actually think is the real deal here is the methodology, because that can be used in many other ways. So we are actually in the process of developing like a web platform. Probably it's going to be an app somewhere down the line, but somewhere where we could run like citizen science experiments using both the self-blinding methodology and probably just some other cool ideas as well. But we are basically want to empower people who are interested in doing science themselves to make the data that they produce more valuable. And adding placebo control to whatever you do is going to be a very crucial element of that. So that's why we are really excited about this whole idea of self-blinding beyond microdosing. And like right now we are just gathering like what are like some of the best ideas. But if consciousness hacking would be interested, like I would be very happy just to keep you guys updated once we roll out something. I mean, realistically, it's going to be Q2 of next year, just because before that, there are like some other smaller projects that are lined up, and I know I am going to be busy with those. But we want to build a relationship with communities who are into citizen science and self-experimentation. That's why I was also keen to talk to you.
I think the communities are really aligned. I mean, it's this type of thing that conscious hacking would be into. I think you could get some volunteers and definitely at least people that would share it, more widely, across like social media platforms.
How many members do you have? Just give me like a sense of the scale.
Yeah, overall, it's around 10,000, I think. Yeah. It's hard to say because people drop in and out, right? But it's around that. And the conference is it's well attended. It's sold out every year. It's new, but there's about like 600, 700 people that attend, I believe.
Yeah. And when is that usually? I mean, obviously right now it's COVID stuff, but usually when it is?
Yeah, it's usually around this time. We did do an online one. Let's see, that was like two or 3 months ago, but it's usually around this time, around November.
Yeah.
I think this community is good for this type of thing, just because I had never heard of this, right? And I kind of follow this stuff, just conscious hacking, this kind of interesting things, self-experimentation, biohacking. And I hadn't heard of your story or your study and your methodology, and just until recently, until I did some.
Just to give you a little bit of a background. So it was like, it started a little bit as like a hippie project. So like, we didn't have like any funding or anything like that.
Mm-hmm.
So this whole self-blinding, like initially it was my idea. And it was at the time when I was starting to work at another job. I was doing some coding in New York. It was still academic job, but in an unrelated field.
Mm-hmm.
And then, it started a little bit out as a hobby project, but then it sort of like grew. Like initially we didn't know whether we're gonna get ethics approval for it. Like that was one of the big risks. Mm-hmm. And that was a lot of back and forth, and there was a lot of bureaucracy. But anyway, in the end, we did it. Mm-hmm. And then we also didn't know whether it's going to work in terms of like people signing up and completing the study. But then sort of did. And but anyway, the point I'm trying to make is that like it's not that like I was like employed on this project. Like if anything, I actually lost some of my own personal money when I was going around and promoting the study. Yeah, I lost some money on the study, but I don't mind. I mean, I'm not talking about huge sums. Part of the reason why we think this study is so cool because it is incredibly cheap to run compared to other, compared to like a regular clinical study. So, I mean, I guess I can tell you the paper is going to be out soon. In terms of the results, so like our study was completed by 191 participants. And just to put that into context, like that makes this very easily the largest placebo-controlled study of psychedelics ever. The second largest one was done in Germany. I think it was either 2019 or 18, but they had 89 people. So the point is that we had more than twice as many people as the second largest study. But that study costed like somewhere in the range of like $1 million, like, somewhere around that. It's that order of magnitude. But our study costed like $10,000. So that's what we see, really the power of this self-blinding is that on one hand, we can have a very large sample size because we have this global reach of the study. And we have the placebo control, which is typically missing from naturalistic study. And it is super cheap on top of it. So like obviously that is a cool combination of factors. Now what we lost out on a little bit is that it's obviously that people use their own psychedelic. So the drug supply was not controlled, and that's a fair criticism. But that being said, like there are some other nootropics that can be purchased legally, and there this issue wouldn't exist. So that's also one of the other reasons, why we want to expand like this methodology has a place in drug science and psychedelics, and we want to pursue that. But we also want to just look into nootropics in general and run studies with this method where we would not have this issue of the uncontrolled drug supply.
Yeah, I think you're absolutely right. I mean, it solves a lot of problems, especially any of these things that it's harder to tell what's going on. These smaller doses, whether it's nootropics, or psychedelics. There's a lot of claims made, and a lot of those people that manufacture and really believe. And there's one here. I think it's probably legit, but it's so hard to tell. And this would be a really cost-effective way to tell, right? Like, and it's so much easier for them to fund something like this than to actually go down the clinical trials. So I think the nootropics is awesome. And I can talk to the company in San Diego, Neurohacker, and
the Neurohacker Collective, right?
Yeah. Them.
Yes. It's they have this formulation. I think it's called Qualia.
Yeah, that's right.
Like they claim us and that's something that we are thinking of testing in this sort of like wider nootropics framework that I was telling you about.
That's great. What he was one of the founders was a guest recently on just in conscious hacking when we were doing live events. So I'd be happy to make an introduction if you're not already in contact with them.
I'm not, but if you could put us in contact, I would be grateful for that. Like, I mean, honestly, because just actually this whole cell binding study is just closing down now. And because of that, like, I didn't just really have the time to look into like funding sources and things like that. There are more plans than time that we have to implement. So, we just have to prioritize and be selective and in what we implement. But anyway, like it's something that is like it's something that we want to do, but it is just not like the top priority right now among some of the other things that we are doing. We are running some other studies on microdosing, which is going to be based on the self-blinding method, but we're going to have a version which is going to be only available to people in London. Because it has an EEG component, so people are going to have to be in the lab for at least a few days.
Oh, nice.
Yeah,
nice.
And that's also going to have some, we want to make some experimentations with active placebos, because we find that is actually super critical to the whole microdosing story. Actually, let me show you. You want to see the results?
Yeah, absolutely.
Okay. Okay. Let me just go share screen and then. Okay, let me just find it. Okay. Okay, so this is the manuscript in all of its glory.
Nice.
Let me just scroll down where we have the figures. So did you, oh yeah, so this is like, the whole cell binding, but I guess then you roughly see how it worked. It basically these QR codes that were like that's where the magic happened. Like basically the truth that we rely on is that these QR codes are machine readable, but not human readable. And going from that, you can make a lot of variations in how you set up your study. And anyway, like, it's more like a general framework. Like you can do many other variations on this.
Yeah, it's really nice, really generalizable.
Yeah. So this is just like, in terms of like the study participants. So we had about 1,600 people signing up, which is a crazy large number.
Yeah. Wow.
But about 250 started only. But so we run a lot of online studies like this, and it's always like this. Like it's always like 20% of the people signing up actually starting it, just because it's so easy to sign up.
Mm-hmm.
And like most people who did not start, they think that we're gonna send them the LSD, even though like when they sign up, like I made that sure it was like bold capital letters flashing in red that we are not providing drugs, but still like most people just saw microdosing and like, oh yeah, sign up, and then then they complain that they haven't received their LSD yet. And I was like, I'm sorry, we're not gonna send you LSD. But anyway, it's just like
the internet.
Doing real life. The internet, exactly. So the way that we structured our studies, that there were like 3 groups, and then so one of the group was the placebo group, and they just took placebo for 4 weeks, and that is the microdose group who did the microdose for the 4 weeks, and there is the half group, which is 2 weeks placebo, 2 weeks microdosing. And what is just kind of like interesting here is that the dropout rate is practically identical across these 3 groups. So like, there were some people who worried that people in the placebo group are going to drop out more because they realize that they're on placebo, but that's not really the case. And what's also, I think it's kind of like interesting in this study is that what you see here, this number is that 80% of the people who have started completed the experiment, which is incredibly high for such online studies. Mm-hmm. Like it always tends to be much, much lower. Like so all of the other imperial studies that have like a similar sort of like online structure to it, like it's usually 50% or less who completed. So this really jumped out to us. But I think the reason why that happened is because like this whole cell blinding thing that you had to do, that was before you started the experiment. So, people who have made it, to this pre-regime time point, like they already bothered setting up the experiment, and they already put in the time and the effort in doing that. And then, once you've done that, then you might as well just go through with it. So
it's so interesting. So front loading an experiment like this may have better outcomes, actually.
I mean, in a way, I think it is just a little bit cheating, because I think, with the front loading, like probably less people have started it compared to other experiments. It's just that like your attrition rate looks better, but that's because you lost the less determined people before they
started. I like that. Okay, so that's like a hack for attrition rates.
Yeah, exactly. Yeah, I'm giving away some secret stuff, but I don't know. Okay, so that's the just how the study flew. Okay, and now we're going to get to the science part, and there's a lot of nuance in interpreting the result, but I think overall it came out to be a lot more interesting than we initially imagined. So what I show you here, these are we call them the accumulative outcomes. So this is the pre-post comparison of 4 weeks of microdosing. And let me just first focus on this mindfulness scale, because here it's easiest to see what I want to show, but it's actually true for all of it. So the red, that's the microdose group. So these are the people who microdose for 4 weeks. And then you can see that from, so here at the bottom, this is where you see the time points of pre-regime, and then they microdose for 4 weeks, that's the post-regime. And then there was also a long-term follow-up 4 weeks later. Between the post-regime and the follow-up, they didn't do drugs. But anyway, this long-term follow-up, that's not that important. But the point is that like, here they clearly improved. And if you just look at this pre to post-regime comparison, that is statistically significant. But what's interesting is that if you add the blue line as well, which is the placebo group, that also increases, and that's also significant. And then, if you make the between group comparison, so if you make the comparison between the placebo and the microdose group, that's not significant anymore. So the change both in the red and in the blue is significant, but the red against the blue is non-significant.
Wow.
So, sort of like in terms of the interpretation, what that means is that yes, microdosing improved mindfulness in a significant manner, but so did taking placebo.
Yeah.
And the difference between the two didn't. Oh, sorry, you are in science as well, right? So okay. Then
that's true across all these dimensions that you're checking. Wow.
Exactly.
Same thing.
For example, here in the life satisfaction, it's just not being significant, but it still clearly increases. So the mindfulness, that's where it appears, but it's basically the same story, that the microdose group always increases, but the placebo also does, and to a very similar degree. So the difference between the microdose and the placebo group is never significant. And then we have the half-half group, which is, we just put it in there because, we wanted to see dose response relationship. And, it's often there, sometimes not. But, honestly, it's because the results are negative, I don't think it's that interesting. If the results would be positive, then I would be much more interested in seeing that dose response relationship. So yeah, this is paranoia, this is also very strong, this is actually was one of the surprising things for me, that we put in paranoia as a negative measure to see if it has any negative effect, and you can see that it really drops down here, but you can see the placebo also does, and this is where the change is the biggest, but there is really no significant difference between the microdose and the placebo group. So there's no difference in the outcome in terms of microdosing and doing the placebos. But I think it's very important to emphasize that this study actually also confirms all of the anecdotes about microdosing, because we clearly see that microdosing improves, mindfulness, well-being, life satisfaction, so on and so on. But it just also happens to decrease, but placebo does to the same degree.
Yeah. So what do you make of that? I mean, should people just go through this sort of placebo theater and not even bother with taking substances? What do you make of it? Yeah. It's so interesting.
Let me continue, and then I'll
Okay.
So one more thing, which is kind of, I think, important to add is that we have this cognition measure here, and this cognition is these are mindfulness and life satisfaction. These are these self-reported questionnaires, which are obviously, very susceptible to the placebo effect because it's all self-reported outcomes. But for the cognition, what we did is that we used, one of these online platforms, which is a proper clinically validated online cognitive test. We actually used a company called Cambridge Brain Sciences, and but anyway, there are some other companies, but the point is that these are much more objective outcomes. And then, there was no significant, the microdose group didn't increase, not even when you are not considering a placebo group. So, in terms of the cognition, there was nothing there.
Nothing, yeah.
And let me show you one more figure, which I think is actually even more interesting than the other one. And that is this one. So this is about the acute outcome. So this is about how you feel today. And the way that we structured it is that it was always on Thursdays, and on every Thursday, participants took a capsule, either placebo or microdose. Let me just zoom in a little bit. So I'm going to focus on these panels, but again, it's going to be same on all of the other panels, the same story.
Okay.
So what you see here it says condition, and then for the condition you have PL and MD, which stands for placebo and microdose. So this is the actual drug condition that people had, either placebo or microdose. And below that, what you see is the guess, and that is that after they completed the test, we asked that, hey, what do you think? What capsule you took today? And that's also placebo or microdose. So it is what was the actual drug condition and what people thought is that drug condition.
Okay.
So this first category, when they took a placebo, when they thought it was a placebo, then on this PANA scale, which is like an acute well-being scale, then the average score was about 13.
Oh, I
So,
see. Yeah.
when the condition is a microdose, but the gas is placebo, it goes up, but very little bit. And you can see it's not significant when the error goes.
Yeah. Yeah.
But when you take a placebo, but you think it's a microdose, then it jumps up. Then it goes up crazy high. And then again, if you, in the microdose condition, there is a little bit of an increase, but very far from significant. And what you see here, these are like just, the p-values associated with that. And one way that I like to look at it, so this first comparison, and we are comparing the first two categories, and we are fixing the guess to be placebo. So, now we are comparing the pure drug effect, the drug condition, placebo versus microdose. And you can see P is 0.26, so it's not significant. If you fix the gas to be microdose, then that's this p-value 0.45, which is again just not significant.
Yeah.
But when you go the other way around, then you fix the drug condition and then you make the comparison between the two gas cases, then it's always significant.
Wow. So yeah, so what do you make? What's going on there? Are there people that actually can tell the difference mixed in with people that just believe, it's just a matter of belief?
So I think what's important is that for 72% of the cases of the capsules, people have known or people have correctly guessed their drug condition. So there's a fair amount of break line going on. And one thing which is just would quickly add here is that so we calculated what is the threshold for the microdose to be supra-perceptual. So when it's becoming indistinguished, and the threshold based on our data is 12 micrograms, and that's kind of cool because last year there was a clinical study on microdosing from the University of Chicago, where they find the threshold to be 30 micrograms. So basically, we have found the same thing. And I think that just, I'm going to circle back, to the uncontrolled drug supply for the study. But I think this actually gives some validity to the self-reported doses because we find the same threshold as clinical studies. So in terms of the large interpretation, so I think by and large, microdosing works, but it does not work because of the pharmacological effect of microdosing. It works because of the psychological expectations associated with microdosing. That would be my one sentence summary of it. But it's it's quite dense.
Do you it's surprising too because
and so just let me add one more thing and then I'm finished with the figure. So it's always the same story what I showed you here. Except again that when we looked at the cognitive performance, which is again this more objective measure, then neither the condition nor the gas made a difference. But it's only true for this. And it's again the same, for this acute. This is post-acute, so this was 2 days after the microdose. But same story. But there is one exception that's not on the figure, but it's here in the table before. So there is actually one scale where there was actually a significant effect even beyond the gas. And that's this is the daily effects VES, so visual analog scale intensity. And that was a significant effect. So they had to rate their drug intensity. And that was the only thing in the study that was actually significant, which again suggests that, they are breaking blind. That's the only thing, which was significant. So I think what's going on is that people who are taking 12 micrograms or more, which is actually the majority of the study, then, they realize that, hey, I'm microdosing because of the perceptual side effects or whatever. And then that's going to trigger those psychological expectations that they have about microdosing. And I think that's actually a key here because microdosing is not it's a cool thing to do. It is people have very positive expectations about. Also, it's not something that your doctor can prescribe to you. So, if you went out your own way to, get some psychedelics, you probably had to meet with a dodgy guy in a back alley to do that. It obviously costed you some money, just the whole cutting up, it takes effort. And I think most people wouldn't do that effort if they wouldn't believe in it. But that means is that there is actually a big bias in the kind of people who are microdosing. The people who
Yeah.
are microdosing, they are the people who are, into microdosing, and that creates this expectancy bias. And I think that is what is getting exploited by microdosing. I don't think that the effect has a lot to do with the pharmacological effect, but rather the psychological effects. You are excited
Yeah.
to be microdosing because it's a cool and exciting topic, and it's going to be a cool dinner conversation. The next time when you are with friends,
Yeah.
and then you take the capsule, you feel a little bit of a tingle, and then I'm microdosing, I'm with cool people now, and then of course it's going to cheer you up. You are cool, and that's what pushes up the scores that we see on the scales.
That's so interesting. I never really considered, like, when you have an illegal substance, the effort going into acquiring that could bump the placebo effect because you're putting more, just more risk. You've invested more, so you really want to see that ROI, I guess, for that.
Yeah, and initially I didn't like so when we launched this study, then I went to quite a few psychedelic societies to talk to them about the study. I was in San Francisco as well. Actually, the first talk that I gave about the study was in San Francisco.
Oh, great.
But anyway, the point is that then, obviously I talked to a lot of microdosers before as well, but in particular, when I talked to people who came to these talks, then, I realized this much more than before, is that it is people who are microdosing, it is, and in particular people who did our study, they are really into microdosing, they did this whole self-blinding process, they are into it enough, to go through the trouble of it. So that's like a filter, that you're only getting the people who are heavily involved already.
Yeah.
Probably what you see here, these are not just your average microdosers, but probably more so than these are the committed ones who did our study, probably. But that being said, I just recently spoke at the ICPR conference. It's a big conference in Amsterdam. It was virtual this year. But there was a clinical group in Amsterdam, and they have found the same thing as we did. So, there is a clinical study which is actually very strongly, or their story is very similar to ours. So, which was just good that it's not just us who find this, but there were some other studies as well. And there's actually one more study from Maastricht, also from the Netherlands. And they find some acute effects, but they never did this break blind analysis. So their analysis stops sort of like at an earlier phase compared to ours. So anyway, I think that's it's gonna be interesting, just how the community looks at these two papers, because seemingly they say different things, but it's just that they have not really analyzed have not built the break blind into their analysis, which we did, and that completely flips the results.
Yeah, it strikes me as this reveals a lot. I mean, about how to, set up placebos for well-being almost. It almost says, at least it hints at that, right? Like that there may be something, like this whole front-loading thing may be something that really any product could, or even therapeutic process could benefit from. It's sort of like the idea of getting a plant or something is beneficial to well-being, right? It's actually like almost taking care of anything on a schedule, maybe like this.
So I think one of the things, or two things which I've realized on this study is that most studies are not really placebo controlled. And by most studies, I don't mean studies on microdosing or psychedelics, but psychiatric medication in general. Because even though there is a formal placebo control group, but if the majority of the participants are breaking blind, then it's not a functional placebo control. And in particular, when you participate in a clinical study, then before you participate, the doctors have to show you a participant's information sheet, and they're going to have to tell you what are the expected side effects of that medication. So let's say that you are going on an antidepressant trial, and the doctor tells you that, hey, I don't know, itching or dry skin is a likely side effect. And then I don't know, a week later you notice that you're itching a lot and your skin is dry. Then you can put it together, then you are probably then in the active group. So
I see what you're saying.
yeah, exactly.
Yeah.
And because of that, or like that's part of the reason, together with the other side effects, that the break blind rate in studies in psychiatric medication is very high. It's typically around or above 80%. So, what that actually tells me is that this whole placebo control, it's just there for the show, because the placebo control group is not doing the job that it was supposed to do, in a way.
Mm-hmm. So in those cases where there's some sort of dead giveaway in your physiological response, then it's like, oh, okay, the placebo game's up, basically.
Yeah. So in a way, we are pretending to run in placebo-controlled studies because that's what we are expecting. But it turns out to be a lot more complicated, because most medications have some sort of side effects that make them very easy to identify. Wow. And there is a very nice meta-analysis from a few years ago that actually shows that across all psychiatric medication, there's a good correlation between the percentage of people who break blind versus study outcomes. So, like, I'm just digging into that literature, and I think it's fascinating, and I think people are not talking about it because obviously it's a little bit undermined, like basically the whole pharmaceutical industry.
And you could see it working the other way too. They could put something in their medication that is salient, even though it has nothing to do with the actual medication, right? But they want to get past these trials. So if you put something that like makes people skin itch or something or whatever it is, then you could see a sinister motivation for this as well.
Yeah, so I think that's like one of the things, this is just looking better placebos, like, placebos that are better at confusing people, that are mimicking the side effects of the active medication. But I think, the other direction, and, there's like, Irving Kirsch and those guys that capture, they're pushing that is that, like, right now the placebo effect is sort of like looked as like this, side effect or like just this little annoying little effect, that you have to get rid of in medicine. But actually, if it is almost as powerful as like antidepressants, then why not use it to your advantage? Like, sort of like exploit the expectations that people have in order to get better outcomes. Like who actually, if you can get the same outcome from a pharmaceutical agent with side effects versus, just a doctor playing mind games with you, I think most people would prefer the mind games rather than taking,
of course,
antidepressants.
Yeah, of course. But the side effects can be terrible, right? I mean, they can interrupt your life, your normal life. Go ahead. Sorry, I interrupted.
Yeah, no, I'm just rambling as well. Like, it's just like saying whatever comes to my mind. But what I think, it's like interesting is that, so this is like, do you know Irving Kirsch? You heard the name?
Mm-mm.
He's a guy who did a lot of like meta-analysis of the efficacy of antidepressants, and he's one of my scientific heroes. And like, he used the Freedom of Information Act to acquire from the FDA data on antidepressant studies that were unpublished. So the way that it works is that, if you are applying for a new drug, then, you have to register the trial with the FDA, but that you are legally not bound to publish the results. So what happened is that obviously, pharmaceuticals published the positive studies, but there were a lot of studies that were just never published because they were negative.
Yeah.
So, when you take all of the studies together, then there is actually, depression is usually measured on it's called the Hamilton scale. And then if you look at, then on average, like on antidepressants, SSRI antidepressants, and people improve about 10 points on this scale. But if you look at the placebo group, they improve 8. So a little bit less, but like, the 2-point difference, that's actually like clinically not significant. Like, that's a very, very small difference. Like, the 10, that's good. But if you can get 8 already from a placebo without side effects, that's much more preferable than 10 with the side effects.
Yeah, have you read that book? It's by a science journalist, Lost Connections. Do you know this book?
Lost Connection? No.
Lost Connections. Oh, yeah. But it summarizes this for like the layman, like this type of. It's basically summary of, it must be have Irving's work, because I mean that was the conclusion, that these
Yeah.
things are barely beating placebo, and it's so dirty that you can, like, if it's negative, you don't have to share, right? You just have to get these 2 studies that pass that show significance, and yeah, over statistically it's going to happen, right? If you can just have infinite negatives that you don't share, you eventually get 2. I mean, so have you thought, like, more like this citizen science project, and like how to harness the placebo for the citizen? That, like, I mean, is this something that you have given much thought? Like, how could the average person, that's, if they're feeling a little bit down or whatever, and they're considering taking medication, is there some protocols that you think that have potential that can harness this placebo a little bit more?
So one of the things which is interesting is that, so there is not a lot of literature in it, but if you look into open label placebos, they seem to be working as well. So, like, most people assume that placebos have to be deceptive, so that, I have to trick you into thinking that I'm giving you an active medication. But there are some small studies where, even if you are being told that, hey, you're going to get placebo, it still works. And I think, but, a lot of the reason why I think it works is because of sort of like the extra clinical care that, you are getting at these studies.
Yeah.
So, like, when you participate in a clinical study, then, the whole medical staff is paying much more attention to you compared to, like, a regular patient. Like, if you're a regular patient at the psychiatric clinic who just have some mild depressive symptoms, then, here's your prescription, off you go. Like, it's going to be something like that. In contrast, if you're in a clinical study, then, then there's all sorts of, like, screening measures, and you have to meet with the staff before, and you have to tell you what the study is going to entail with the participants' information sheet. And then, somewhat, and then very often, like, investigators have some sort of financial interest in the studies that are being done as well. So, they have stakes in that working. So they want to make sure that everything is going smoothly, there are going to be no adverse reactions, so on and so on. And because of that, there is, like, much more attention on you compared to, like, regular practice. And I think, that's sort of like that's like an enhanced placebo effect. There is actually, like, a paper which sort of, like, what they try to show is that the placebo effect can broadly be separated into 3 components. And by far, like, this human relations, human connection effect is the strongest one. It was done by a guy called Ted Kapchuk, and it's about deceptive acupuncture. And anyway, I don't remember the title of the paper, but if you look around, you're gonna find it. It's kind of cool, because what they did is that there was just, like, this sort of, like, waiting list group. And then there was a group where people were getting fake acupuncture, but the therapist was, like, very cold, like, in terms of, like, he wasn't chatting with you while you were there. It was just like, went there and did the fake acupuncture. And then in the third group, the acupuncture was still fake, but the guy who did the fake acupuncture, he was talkative, like, really paying attention to what you do. He stayed there to chat with you afterwards. It was very, like, warm and paying attention. And like, and there was a very large difference between those 2 groups. Like, suggesting is that, like, actually the best therapy is just, like, people giving a shit about you.
Yeah. And also, like, in acupuncture, like, the best therapy just might be that person is warm and, like, caring, and
yes.
nothing to do with the actual like, these personalities are charisma or something is much it's underreported, the effects, like, of these.
Yeah, I mean, that's, like, the driving force behind, I think, much of complementary medicine. Like, it is just it's basically just a placebo effect. And, like, I mean, don't get me wrong, I really, really like science. I mean, I'm a very big science enthusiast, but I think one area where science has really failed is really mental health. And here, like, our best tools are, like, hovering a little bit above placebo at best. But this is somewhere where we really haven't made much progress at all.
Yeah, it's really sad that is the case, and it hasn't it's been basically stagnant for what's, decades, right? There's like
Yeah,
every other medical field is improving. We're
yeah,
getting better treatment.
exactly. Like since the SSRIs came along first, which I think was like somewhere in the second half of the 80s, like there has been variations on SSRIs and the whole chemical imbalance theory, but nothing really worked. And actually, I think right now there is innovation with the psychedelic therapy, but it's with the large doses.
Yeah, yeah,
They seem to be very effective,
yeah.
but not microdosing. But yeah, anyway, we'll see. Like I'm fairly positive that psychedelics are going to be really a breakthrough in this area. But I think it's interesting, and especially in terms of like our paper and our resource for microdosing, is that like if you're taking a large dose, then everybody is breaking blind. Like Timothy Leary made that point. Is that like placebo-controlled studies on LSD are a little bit of a waste of time and money because everybody will know who is active and who is placebo.
Mm-hmm.
But the point is that like given that like right now I feel that somewhere we are near like peak psychedelic. Like they still have a little bit of mysticism of like being illegal, and they are still a little bit like this hidden world to most people, and that adds to their magic. But like 30 years down the line, when it's going to be like much more mainstream, and then your therapist just sends you to mushrooms, it's going to be, oh man, mushrooms again, oh freaking yeah, it's just going to be like that boring, or like that they're going to lose a lot of that excitement and that cultural perception, which right now actually I think psychedelic therapy is as good as it's going to get, because you are getting like an enhanced placebo together with the pharmaceutical therapy. But a few decades down the line, when it's mainstream and it's not exciting anymore, and then when it's going to lose out on that.
Yeah. It kind of reminds me of like a TV show like Lost or something that gets worse as it goes, as there's less mystery or something. And Eleusinian mysteries, right? Their rule was you can only do it once, from what I understand, and that was it. You had to make a big trek to it, and that that I don't know if you know anything about this, like ancient.
I mean, I roughly know this much.
Yeah, I mean, there's not much to know, but that it strikes me as like maybe they sort of knew this, right? Like you don't want this to be commonplace. You don't want this to be sort of so profane. So you lose that mystery, you lose that placebo, you lose the set and setting, that is grandeur that the whole culture supports, and we have that right now. We have that, right? Because it's all like there's great music that's made on it, there's great art, there's these people that have these life-breaking or life-changing experiences and they dedicate their life to service. There's all this, like there's almost no sort of negativity flowing, or I shouldn't say there's some negativity out there, but there's just nothing ordinary about psychedelics. There's just nothing. All the stories are extraordinary, and I hadn't really considered that could be the huge effect of what's going on. We're going to lose it over the next 10 years.
Yeah, I mean, I don't know how big that component is going to be. But I think there's just something exciting to keep in mind as we move forward. Anyway, it's just a thought. But like there is a similar thing, with mindfulness meditation. Is that like when in the early 2000s, like mindfulness was all the craze. Then in all of the clinical studies, the results were much better than in recent studies. Like I guess mindfulness is a little bit something that has become westernized by now. I mean, like I have Headspace on my phone. Like there is an app for that. Like it lost a little bit again of that mystery, that excitement. Which was probably there in the early 2000s. So anyway, I'm not sure where exactly are the deadlines, but the point is that right now it has become much more mainstream, and then you lose out a little bit on the excitement on that, and that excitement is going to add to the placebo effect.
No, it's something that's I never heard it put that way. That how dramatic, or at least like just speculating that could be a really dramatic effect. And I think it tracks well with mindfulness, like where it used to be up on the mountaintops, right? And now you can basically get prescribed mindfulness from your HR executive,
Yeah.
which is a little bit different setting. No, that's fascinating. So I don't want to take up too much of your time. You've been so generous, and this has been awesome. This is, and so I want to be mindful of that. But I would love for you to talk a little bit about the citizen science, where you're going, if you have any like concrete thoughts, or how people can help, how people can join, follow all this stuff, right? Get involved if that's helpful to you.
So, I mean, I don't have like a very, a strict plan or really a plan at all. It's just like, trying to recycle the self-blinding methodology in the best way possible. What I am thinking about is just like create an open science platform. So, the way that it would work, and this is just a vision, is that like, all of the data ever produced in the study would be public. I'm a little bit, it's a little bit same with psychedelics, there are these companies now that make money, and then it just loses so much of the charm. So I would like to keep, what I do as much free and open as possible. So anyway, this very strong commitment to open science would be a strong point of it. All of the study protocols are public. All of the data that we ever produced is public in an anonymized manner, but it's there for everybody to benefit. And I think that is a great motivation for people to use the platform. Because like, if you're not contributing, it's not a PR project of a big company that wants to make money off your self-experimentation. Like, the best that we can give back to the community is their own data, and help them to interpret it is that what that could be useful for your condition or whatever goal that you are seeking.
And do you envision users of this platform to run their own studies? Is that something they could recruit?
There would have to be some structure, and that's exactly the challenge. If everybody does what they want to do, then it's too free floating, and then there is no structure, and then then it would be hard to extract scientifically useful data. But if you put more and more structure into it, then you're going to lose out participants because they want to do differently. So I think finding the right balance between giving it enough structure so that scientifically it's useful, but also that it's free enough so that people can find their niche within it. I think that's actually the challenge of it, and finding that balance. So like for example, I mean, I think self-blinding would be a big part of it, not just because like I happen to come from that angle, but that's genuinely one of the big criticism of naturalistic studies is that you don't control it for that, but with this we can. So like one thing which I'm thinking about is that you would be able to order like these self-blinding kits, which would contain like the capsules, some QR codes, anyway, everything that you need in order to self-blind. And then you could take, for example, your Qualia, the Neurohacker Collective capsule that we did, and then you could just measure the effect that it has on you in a placebo-controlled manner and share it with everybody else. Let's figure it out whether it really benefits cognition or not. I mean, I don't know. I don't care particularly about the answer, but I want to test it in a right scientific framework.
Yeah, no, and it's something that it's a feature that should be on the internet, basically. That's not, right? Like there's this idea, the citizen science, and having protocols like the self-blinding one is a great example because it's cheap. You could order the kit, you mix up your things, and you could.
And then I will be happy, to incorporate like other ideas of it. I mean, the one thing is just this open science framework, because I feel like is that like that's the people who are doing self-experimentation, obviously they tend to be into science, and they tend to be not stupid people. So like if you are collecting data for your private, once like private money is involved, it gets a lot more complicated. But I think if there is like a very transparent project, like we could even ask like people, I don't know, like $5 a month, like a subscription fee sort of thing. Like the data would be still open, but just sort of like, I think people would support that if they get the data back, and then we would be able to create like this massive medical database. Like, with self-blinding. And also what I think is important is that the data would be in the context of real life. I mean, we talked about, how clinical studies are distorting the outcomes because of that extra care and, all of the flashy things that the study involves. But then here you would have what are the outcomes in the context of real life people going about their everyday life, and then how that given medicine affects them in that real life context, which I think is actually much more relevant to clinical studies. So, clinical studies are always like, oh yeah, but it's better controlled. Like, often, like, for example, they take blood samples, to check whether the medication was taken, or urine sample, or whatever. But guess what? In real life, like, yes, people sometimes miss their medication. Like, that's not an artifact of being or like, how to put it, like, ultimately you don't care about whether something works in a clinical study, you care about whether it works in real life. So like, right now we are having, I think, in medicine, that attitude is that real life should mimic the way the clinical studies are run, but that's stupid. Like, the science should reflect the real life, not the other way around.
So, like, would you suggest someone, if they got some medication from their psychiatrist, whatever, like SSRIs, and like to run the self-blinding, like, is that something that you foresee, like that, to see like, okay, I got something, but I don't really, what's important is, does it work in my life? And then can I tell from the placebo? Is that too far, or do you imagine that
so, I mean, obviously SSRIs are a little bit different because that's something that the doctor prescribes to you. So that's not something that I would start with. I would start with things that, like, that are over the counter sort of thing.
No, of course. But I mean, I'm like, say this vision is executed, and is it something that could be, because I think your point is that, well, it's very important to have clinical trials, but it's also important to have these sort of naturalistic studies. And if you can do it within your own context, maybe that's even better to see, because, or maybe I'm taking that wrong, but it does seem like you could attach that on top of, it's an interesting way for anyone to test anything that they're supposed to take, as long as it's not like life-saving, of course, medication.
Yeah. Real hard medication. Not placebo then.
But I don't know, is that taking it too far in your head? I mean, I could see that being an augmentation of this, like,
I mean, obviously, it's. I mean, as I said, this is like a broad vision. I don't have very firm plans, and it's depending on what it, see how it goes. I'm kind of right now busy with that London-based follow-up and a few other studies, and a lot depends on how we can get money. Like right now, I am working at Imperial College. I'm talking to you from Budapest, but I work at Imperial, so it's but then, I'm gonna look at, like, possible scientific funding, but I'm also thinking of maybe like a big crowdfunding campaign to kickstart this a little bit. I was actually involved in a fairly successful science Kickstarter before with, it was called the Open Worm Project. And what we did was...
what was it again?
Open Worm. Let me send it over to you. And, anyway, we ran this is a science project, and we ran a Kickstarter for that, and we managed to raise 120K, and which was like pretty good money, like for what it was.
Totally.
So that's, and because of like this very open science nature of the vision that I tell you about, I think this would be like something worth trying. Oops. No, what's happening now? I lost you. Oh, here you are. Okay. So anyway, but like I mean, if you guys, or the Neurohacker Collective, would be interested, like, I mean, especially like I mean, obviously money is one aspect of it. Like if I would dedicate myself full time to this, I need to make a living, and probably it's going to be bigger than, like, even early on, I think it would require 2-3 people, developers. I mean, I'm kind of a software engineer myself, so like I could be one, not like it is. But anyway, but beyond that, like just talking to people, like that would be probably the most useful.
No,
Like
I think
actually, like if you guys are making a conference, like, I mean, I keep an eye out for it as well. But I mean, if there would be an opportunity to talk there, I would love it,
no,
just to be able to connect with the people and
for sure. I mean, this
talk
is right up.
about the microdosing and pitch what I just told you as well.
No, I think it's great. I mean, for both reasons, I think it fits really well. There's also the Transformative Tech conference too, and I may be able to introduce you some people there. It's the same kind of thing. I mean, citizen science on a platform is really right up their alley, along with the microdosing studies you've already done. The Newer Hacker Collective, I can introduce you to him. And I'm interested too. I mean, I'm a developer as well. I'm a full stack developer, so it's something
Oh,
that,
okay.
like what I'm frustrated with is there's a lot of sort of science people that studied science and love science, but then they go off to be engineers. I mean, this is Silicon Valley, basically, right? They all understand science.
Yeah. I hear you.
And but then it's frustrating because you can't really participate. It's really hard. There's a real sort of walled garden there often. Like you have to go full on to go get your PhD and whatever. Usually, right? It's a pretty strict path, and there's good reason for that. But also, I think that there's avenues for informed citizens to contribute to the scientific knowledge base by running careful studies through a platform or participating in such studies. So I think it's definitely piqued my interest. I've seen this problem, and I mean the self-blinding placebo thing is one of the coolest things I've seen that addresses this, right? To get people involved without having to go through. That's even a bigger walled garden, the clinical trials, right? You have to have a huge grant or a pharmaceutical medical company backing you, right? And you've sort of hacked that system so you can get some data, and it's awesome that it mimics what the clinical trials have said, right? Like that's a really that's a really
very much
good,
so.
Yeah, that's so. I mean, really, you should feel. I hope you feel great about that. I think that's a real contribution in my head. So no,
it feels like we hacked the system a bit, but in a good way.
Yeah, absolutely. Yeah, I think it definitely brought me some joy just when I heard about that. So yeah, I mean, I'm happy to introduce you to whoever I know. Maybe something can come with that to promote whatever you're going to do through the community. Of course, I'll check out this open warm thing, and if you're looking for developers, keep a dialogue. Maybe like at least advise. I don't know what your experience is, but my day to day is I develop applications. So
I'm a little bit like I mean, I did my PhD and I picked up coding on the side. So I'm like that avenue, like I was having a physics PhD and I joined the neuroscience lab, and then it was like obviously it's that he's going to do the data analysis, but
well that's
a bit like that.
Yeah, well that's excellent training. Like I actually work with a guy that he got his PhD in meteorology, so he had a lot of data modeling, but now he's in full just whatever, he's a developer for a company. Like
I don't have like formal training, and like initially I'm like that sort of person did like MATLAB first, and then MATLAB is good for like quick and dirty analysis, but it's not good for anything beyond that. And then obviously it was just like bug after bug when I was doing my PhD, and at some point I was just like I need to do something about it, and then I started to dig into like coding and how it's done like properly, and then started using Python, and then what was actually the big breakthrough for me is just like really testing the code. Like I mean, it is just like it's like when I was doing my PhD in neuroscience lab, there are people who are using code to analyze all sorts of data, but nobody ever tested their code. It's if you are not coming from a computer science background, you don't even hear that term. That was like the big breakthrough for me is that like, this is what we should be doing.
Well, I could see that being very problematic because some code errors are very tricky and they could look like real life, especially if you're spitting out data like you may not pick up.
I guarantee you is that I think if you would really go through every published study, like at least 1/3 of them we would find something bigger than a minor error in terms of like how the data analysis was
Wow.
done. Or
Wow.
yeah, I mean, it's just I'm talking from. I mean, it's just because everybody, like, realistically, people are not gonna check your work. Like, there's just
Yeah.
like no
Who
resources
could,
for that.
it's so expensive. Like to go
Yes.
check someone's.
And bear in mind, most of these actual, like, most of the dirty work in science, in terms of like, really analyzing the data, is done by PhD students who are the least experienced and who have the most pressure in producing something. So I think, like most of those errors are not errors in the sense that, like, they're not conscious errors. I don't think people want to cheat. I mean, obviously, sometimes they do, but I don't think that's the issue. It's the unintentional errors, I think, are much more dominant. And you're trying to do the right thing, but you are like this mistrust PhD student, and then you get the p-value equals 0.003, and then you might use the wrong test or something like that, but you're gonna leave it there.
Yeah, no, I mean, there's definitely the incentives aren't aligned really to always, unless you're just a true scientist, right? Like, you're not scared to have a null result. No, yeah, that's it's a huge problem in the social sciences, right? I mean, the reproducibility is there's a huge scandal. It's like 1 in 2 papers, the major papers couldn't be reproduced or something like this, right? Or maybe it was just psychology, but I think it's to your point, right?
There's a lot of discussion on that because, like, it tends to be the case that, like, you reproduce some of the paper, some of it is not. So, like, when a result is replicated, it's not black and white. Like, it's not binary. Usually, it's some shade of gray.
I see. Okay, so that doesn't make as good a headline, I guess.
Yeah, exactly.
And I'm
but
guilty
it's good
that
people started to talk about it. But I mean, I think really the solution is aligning the incentives within science with doing good science, which is not happening now. And that's something also, with this citizen science, that could be somewhere, where we just completely cut off that classic academic, like the issues with academia, like this basically the flow of the prestige and the money. That's really it. I mean, there was this paper. It's kind of interesting, but it compares academia to a drug gang, because, like, in academia as well, like, there is a few people on top, and they are very well off. I mean, in terms of brand, and like, if you're looking at the big shots, and those people, are like producing, like, I don't know, like 100 papers a year. I mean, they don't even read those papers. It is just that they are involved in the collaboration, something like that. But then, of course, at that point, it's impossible. That they probably don't even read all of those papers.
Yeah.
And then, then you go down the food chain, and then you have like these really disposable PhD students who are doing the actual real life work. They are the ones who are doing the data collection and the analysis. Probably some postdoc is supervising them or something like that. And then, from these minions, and doing a PhD is a lot of hard work. Very few is going to make it to the top. So it's a little bit like, the street level pusher, versus the Pablo Escobars. And everybody, of course, is a PhD student, wants to make it to the top. But it's gonna be like most PhD students are just not gonna do that.
No, the job market is crazy. I've heard, like, for my like one of my closest friends, like, he went through that gauntlet. He got a position at Stanford, but he said it was like there was like 300 applicants for that one position.
It's crazy. It basically just comes down to, like, luck, almost, you feel like, because, like, and because probably all of those 300 applicants, they're probably all freaking smart and had freaking good CVs, and sure. Like,
There's a guy, kind of forget his name, but he just wrote a book on meritocracy, and he was talking about the academic admissions, and he had a really good idea, and he said, like, really, you should get to a certain level that you're qualified to apply, and then it should be a lottery. So, like, like at Harvard, here is like our most prestigious university, maybe MIT, depending on what you want to do, or Stanford. But you get it, right? You just you need a certain criteria, and then put some luck, because it's luck anyways, right? Usually there's going to be some. Just acknowledge that luck plays a role. and maybe people won't be so stressed out, and so yeah, just they won't covet those positions as much either, because everyone that's at a tenured professor at Harvard had some luck, although it wasn't all just they're doing. So
Of course.
it reminds me of what you're saying, but yeah, no, this has been excellent, man. Thank you. I mean, for taking your time out and yeah, just sharing this, and I'm excited to share this with the community, and yeah, I want to keep me in the loop with what's going
Yeah, sure.
on.
Yeah, I mean,
I,
also, yeah.
yeah, if you we'll just keep a dialogue going. I'm happy to hear more of what stage the citizen science platform is, and like I said, I'll make the introduction, so maybe you could use the self-blinding at Neurohacker, or even, he probably knows everyone in that industry.
Yeah,
So.
I mean, let's see how things are moving forward. Yeah, I mean, I know that I'm going to be busy, and anyway, yeah, it's things going to move forward. I'm not sure at what pace and where it's going to go, but something is going to happen.
Yeah, of course. It's always like up in the air for sure. It's nothing's hardened, but I'm happy to throw some balls up in the air to help you.
Thank you very much. I appreciate it.
That's helpful. Yeah, no, absolutely. I'm really grateful for the work that you're doing and the time you put into trying to shed some light on the microdosing thing. It's a big thing in Silicon Valley, and yeah, it just really helps to there's not a lot
I
of
think there's going to be a big backlash, because obviously our results are like fairly negative. So I'm just kind of curious how the community is going to react. I think we're going to get a lot of criticism. But anyway, you'll see. Like, I mean, I feel like me as a scientist, I'm responsible for collecting, analyzing the data, but I'm not responsible for what the results are. Absolutely. And that was our attitude right from the beginning, is that we don't care. Like, we are not, microdosing zealots, But we thought it's interesting enough to look into it.
Yeah, no, that's good. We need that in the psychedelic science community, right? There's been zealots for way too long, people that were just tripping, and they wanted to prove that it was amazing. And we're finally getting real science, I think, like real dedicated scientists to it. So I appreciate it, and I think there's a lot of good news in what, even if you're a microdoser, I think it's this idea of maybe considering how powerful the placebo is to yourself and your own rituals, and I think that's good news. I think that's exciting.
Yeah, we should use that. Use that to your advantage. Yeah. Exactly.
Yeah, absolutely. So that's great. Yeah. Well, let's stay in touch, and anytime, just if there's any way I can help out in whatever you're doing, your future projects, just let me know.
All right, cool, Zach. Thank you very much. I'm going to send you an email from my personal email, not the study email. So just use that in the future. I mean, probably you reach me at Microdose, the other one as well. But anyway, just use that.
Oh, okay. Okay, good. I'll do that.
All right, cool, Zach. Have a good weekend.
Yeah, you too. Take care.